Jesus, take the wheel. I wish I had $1 for every time I've had to say, please put the cigarette down and use both hands on the walker. Apparently, it keeps her balanced.
the craziness of caregiving. Oh my gosh. And you imagine that's like your mom or your dad. I mean,
it was my mom. Well, my mom quit smoking when she was, I don't know, late in the middle of her problems. And but she used to say stuff like that. It's my friend. It's that generation. Smoking was their friend.
Yeah. And here we are
But it
today.
keeps her balanced. That one's interesting.
No car seats. Our parents smoked, yet we are here today.
We are still here.
Hi, my name is Levi, and this is, I was going to say, because I record so many, this is Unlimited Access by Ursamin. All right, so, and
I'm Shannon Ellsworth, founder and CEO of Ursamin. I was just thinking you were going to say, and we're still here. However, we're now going to talk about how many people have health issues because of what they started back then. Thank you very much.
Okay, so the topics today.
Yeah.
Let's talk about this Health Action Council 2023 white paper. I'll read some of the data real quickly here. It says, new study, millennials exceed older generations in chronic health conditions. A surprising generational trend has emerged in the United Health Action, a lot of words there, action report, that forever changes the medical plan management and that cost of quality of healthcare itself. Millennials are exceeding all older generations in chronic healthcare conditions and overall burden to the system. Based on one of the world's most comprehensive claims databases, the white paper reveals that those aged 27 to 42, which is a millennial.
Yeah.
I thought I was a millennial.
You are not.
What am I?
You're probably Gen X, right?
Oh, Gen X. I'm Gen X. That's fair. I'm 48. That's right. Okay, so here's the numbers. Diabetes, 106% more hospital admissions. Hypertension, 55% more emergency room and urgent care visits.
That's crazy.
Obesity, 31% more ER and urgent care visits and 29% more hospital admissions. Back disorders, 22% higher ER and it says UC, but urgent care visits, 46% higher admissions. And then osteoarthritis, 36% higher ER and UC visits. So there you go. I've got some questions for you. Let me see if I got my questions.
I have some questions too.
Go ahead.
Well, I got to wonder if the ER visits are because of are they a result of the illness, or are they a result of the fact that you can't get in to see your doctor right now? And so what happens, and millennials can't get in, they don't want to do doctor visits, they will only do telehealth. And that's it. There's a partner report to that says millennials just refuse to go into their provider. So they're doing all these telehealth visits, which means they're doing like well care or well now and urgent visits. So they come in, they go in, they do an appointment. Hey, I don't feel well. They get a med, but it's not managing this chronic illness over time. So when they really have a flare up, it's acute and they end up in the ER. So really I just got thinking, I was like, all of a sudden a bunch of questions that I've got to quickly look through and see if I can find the answers to.
Well, I also thought it was almost a cultural thing as opposed to them having higher, osteoporosis or whatever, or arthritis. I think it's more of like, I don't know how to handle the situation. I don't have a doctor. Okay. I just go to the ER. So it's not that whereas maybe as we get older, we have doctors, we've dealt with it for longer, and we know how to handle it on our own. I don't know.
Yeah, that's a really good question. I'm actually looking at it right now, and I'm like, okay, so they're saying, and it's about ER visits and hospital admissions. So you're right. Do they not know how to manage it? Are they not being targeted to manage it, which goes hand in hand with you're not going to your doctor? And so the doctors today are so overwhelmed that they don't have the ability to do education for children probably the way they did years ago. So yeah, are they getting the education? Are they putting that into practice? I mean, I don't know. That's a big conversation to have.
Well, here, let's see here. The study finds that employers should focus on preventative care and education to address the growing burden of chronic conditions among millennials. How does Ursamin support this goal? In what role do we see our platform playing and promoting preventative care and education?
That's a very well thought out question, Levi. Did you just come up with that? Yeah. So no. So that is kind of the heart and soul of what Ursamin is about. So we talk a lot about how we collect records and, we pull that together and help you get all that data in one place. The idea being that chronic illness creates more indicators of health anomalies. So you might be doing fine, your blood work's fine, but when you have a chronic illness, all of a sudden your numbers go like this. What's normal for you isn't going to be the same as normal for me. So understanding that baseline and then understanding how to manage that requires education. So I started looking into this 2 years ago for myself because I have back issues and I have stomach issues. And I don't know if you know, but the the gut is kind of, they say it's the beginning of the end. Like if you don't digest well, you have other problems. So, but my point being is understanding what is normal for me. And then I learned it was like, you have to become your own scientist. You have to become your own kind of pre-qualifying doctor that says, okay, what is my baseline? And then look at that. And then how do you manage it? And how do you feel in the treatment that you get? So education is really critical. And then also follow up with your doctor that says, did that work for you? How do you feel? Do you feel good? Do you feel great? And so what we're doing within Ursamin not only is, hey, let's make sure everybody has the baseline, but then let's also make sure that education is tailored to you based on what your provider thinks you need to see, because not all diseases process the same. And then follow-up, it's called patient-reported outcomes. It's a very fancy name for you check a smiley face that you feel good or you don't. Do you feel good as opposed to getting a med and you just feel worse and worse and worse, and you end up back in the ER because the med they gave you didn't feel better, but you didn't want to say you didn't feel better. This way you get to say, I feel better, I don't, because there's so many brands of drugs now. If one doesn't work, another one might, and they just try again. So it's really critical that I think millennials get into, and we don't, I think a lot of people forget the millennials because they say, oh, they don't have tons of health records. Well, they actually do. They're living with their wearables every day that's reporting out incidences and differences every day.
What are some of the broader implications for our society? So I'm just looking at my notes here, and it says, do you see Ursamin contributing to the larger effort to improve health outcomes for especially at-risk populations? Yeah,
absolutely. I mean, that's diagnostic accuracy, making sure that people have that feedback loop between patient and provider doesn't exist today, except for if you go into what they're calling brick and mortar. If you go in and meet with a doctor, there's a 6-month or, hey, call me in 3 months. So that quick feedback loop between you and the provider that doesn't cost a ton of time on anybody's part to ensure that you're on the right plan will absolutely drive better outcomes. Hands down, you're going to have the data. You're going to be able to say, I feel better, I don't feel better. Let's make the next move. And whoever, even if you see a different doctor every day, they have the same information and can say, where were you yesterday? Where do we need you to be tomorrow? Let's try that. So that's so critical to the future. And I think at-risk populations really talks about those. That's a big topic. I don't even know if I can address the whole thing. But a good example is like in the rural community where a doctor is, 100 miles away. They're not going to drive back and forth to the doctor. Like, listen, I had a neurology appointment that I had to go in 3 times to get 3 different meds, and it still didn't solve my problem. People in the rural area, they can't do that. They'll go in once, get a med, go home, and then they end up sick and in the ER because they can't drive 100 miles, especially on today's gas prices, to get that data. So you're really... Yeah.
It's kind of like what we were talking about beforehand is like, hey, I got like a dry foot and a baby foot or whatever I was talking about.
Baby foot, my favorite.
whatever that we say is. But I was like, instead of going to the doctor, because I'm afraid of going to the doctor, not because it's a bad diagnosis. It's just like, it's a lot of work.
For a dry foot.
Whereas if we have this repository of information, the shared data, where if I call the nurse at my doctor's office and say, hey, I got something going on, and they can quickly look in to this database, Ursamin, and see all the data and go, oh, yeah, this is probably what's going on. Because I tell them what's going on. Maybe I upload a picture to it or whatever.
Yep.
And there you go.
Or chances they know. Here, listen, chances are they already know as soon as you call.
Yeah, there's a lot of dry foot going around.
You and the 10 other Uber drivers are using their right foot, and it's getting very dry, huh?
Way too much.
And so you just need to use some lotion. Let me look up what I love, and I've got a couple of doctors doing this. Hey, I'm going to drop it in your portal. So, hey, they can push a button and say, boom, Levi, and anybody else who says, I've got dry foot, push out this article that says, this might be why, right? And winter is terrible, and there's all sorts of things.
Well, thankfully, my granddaughter, she's at our house a lot, and she has that, she still wears a diaper, so she's got that jelly. It's like
oh dear.
It's like petroleum jelly.
I feel like we're going down a.
But that's but it's like that.
I feel like
that's what I've been using on my foot, and it's
like every other female on the planet learned that dry skin actually needs that. But yes, I mean, and that's where we want guys to ask questions because they won't. How many guys are like, I don't want to look stupid?
That's right.
And you're like, well,
I'll
you're
just
not.
Publish it on the podcast.
I ain't afraid. Ain't no shame.
No shame. I have another one for the next episode, so stay tuned for the next episode. This will be a good one.
Can't wait.
Well, let's wrap today. Okay. Shannon, you got any final words?
No, thank you so much. Millennials, join us.
So again, my name is Levi, and here at Ursamin, what we believe is that people make better decisions and have better health outcomes when everybody has access to the exact same information in a shared database. So again, like and subscribe. Thank you so much. Bye.
Thank you.